Hi, my name is Maria, and I did my project on the Haiti cholera outbreak from 2010. This specific water issue is a combination of both water quality and water scarcity. Since developing countries are often fighting for resources, water is one of the most crucial resources for survival. These countries tend to lack adequate sources of water and resort to getting polluted water of very low quality. That's why it's both water quality and water scarcity. And this case of water quality is what led to the 2010 Haiti cholera outbreak. Obviously, the citizens of Haiti were the ones that were the most affected by the cholera outbreak, but there were also cases in the Virgin Islands, Venezuela, Dominican Republic, and Puerto Rico. Human activity was the main cause of this outbreak, specifically the introduction of bacteria which contaminated the Mai tributary system of the Artibonite River. Since society is so interconnected, there are many characteristics of society that contributed to or mitigated the negative impacts of the cholera outbreak. Due to technological advancements, the CDC and other organizations were able to help reduce the negative effects of the outbreak and lowered the number of possible deaths from cholera. Politicians and leaders of more developed countries were urged and pressured to help Haiti and other countries that were affected by this outbreak. It is obvious that economic status had a lot to do with the spread, as the countries that were hit the hardest were also the least likely to have adequate resources to protect their own citizens. Additionally, as you can see by the picture on the left, is the protests in Haiti that were caused by the UN involvement in the outbreak. The UN actually admitted that their own peacekeepers, who were sent to Nepal to participate in emergency rescue work due to the devastating earthquake that hit Haiti in early 2010, were to blame for the outbreak. The peacekeepers stayed in camps near the river that many Haitians used to collect their water, and the peacekeepers dumped their raw sewage into the river, which caused the outbreak. The UN did not admit this until 6 years after the outbreak in 2016. Haiti gets a steady amount of precipitation, as is seen by the diagram on the right. Participation in the hydrologic cycle allowed the infectious bacteria from the peacekeepers to travel to places where it might not have reached otherwise. Cholera is passed on through contaminated feces, and Haiti's lack of a sewage system and adequate water resources allowed the precipitation to spread the feces that was sitting on the surface and allowed it to reach other populations that it probably wouldn't have reached otherwise. Since the death rate of cholera was very high and the outbreak was spreading rapidly, there was immediate action to solve this issue by the Haitian Ministry of Public Health and Population and the U.S. government. They focused on distributing medical supplies and training, preventing disease spread by promoting point of use water treatment and safe storage in the home, hand washing, and proper sewage disposal, defined risk factors and guided prevention strategies, and established a national cholera surveillance system to monitor the spread of the disease. Children are now being administered oral vaccines against cholera as part of a large scale vaccination campaign. And in 2020, Haiti finally reached their milestone of an entire year free from any new cases of the deadly waterborne disease. And that is the end of my presentation. And on this page, I have my sources.